Good afternoon, everybody, or good morning, depending on where in the world you are. We are going to get started in about 30 seconds. Just going to wait for a critical mass of attendees to stop trickling in. So stand by. We have an amazing cast today. As always, I cannot wait in honor of the month of Mother's Day. Mother's Month is what I'm going to call this. May for Mother's Month. All right. I'd say we're at critical mass. Whether you're watching it live or watching this recorded, welcome to I've lost track of what number episode. I think we're over six now of the S3 Collective's webinar series surrounding amplifying the medical patient's voice. This is a amazing episode that I am really excited to kick off with Mo as our fearless leader and moderator from Leaf 411, where this month we are focused on lessons from mothers in advocacy and caregiving. I'm Dave Valancourt, board chairman of the S3 Collective, a nonprofit focusing on supporting standards, science, and safety for cannabis and cannabinoid medicines. We are part of the FDA's Network of Experts program and work through grant funding to advance evidence-based research to inform safe and sound policies nationally and internationally. Thank you again for joining. As always, this episode, as all others are, will be available on demand in perpetuity. So if you attended and heard something today and you realize that you've got some friends or colleagues that need to hear this, pass the link along. And if you have any questions at any time, we can always be reached at s3collective.org. Go to our website, sign up for our great newsletter, shoot us an email. We're here to help you. This webinar, as all webinars, is for you, the attendees. We do this for you guys. So if you've got feedback, you got questions, throw them in the chat, especially today live. So please use the Q&A feature to throw a question out there, and we will do our best to get these rock star moms on the hot seat to answer your questions. What else am I missing? I think without further ado, it is time for me to hand it over to Mo to take this away. Mo?
Great. Thank you, David, so much for your work and everything that you're doing with safety, science, and standards. That is the foundation of any good industry to provide, uh, safe and effective products to the public. So welcome, everyone. I'm so glad you're here. My name is Maureen DeBay Savage. I'm better known as Mo. I am an ambassador and educator of the national nonprofit Leaf 411. We provide a cannabis nurse guidance call line, providing public health service to guide our constituents to safe and effective cannabis consumption. So check us out and see what we can offer to the public and anyone looking to this plant for guidance to understand it better for therapeutic benefits. As we begin, we always would like to thank the people who have been holding this plant up from the beginning of time. And it truly has been used from the beginning of time therapeutically, medicinally, spiritually, and even for food and shelter. But definitely through the debilitating prohibition years, even as it continues today in states, even states that are regulated, and honoring those who have been wrongly harmed by exercising their right to consume this plant for healing. And as you'll hear today, how hard it is to decide that legal decision to what is right for your child with our guest today in Amplifying the Medical Voice and the Mother's Advocacy and Caregiving. So please check out the full bios of our guests, but we would rather have them tell you more about them and what they're doing. We are going to drop their information in the chat, but let's get started with our honorable mothers and share currently. We'll start with you, Dara, of what are you doing right now? What's your current active role working on amplifying the medical patient voice?
Hi, how are you all doing? I'm Dara. I currently serve as Operations Director of Unlimited Sciences, which is a nonprofit that's dedicated to psychedelic research, free education that operates under the Realm of Caring Foundation. A lot of work we do at Unlimited Sciences focuses on education, harm reduction, helping people navigate complex questions in a safer and more informed way. And Realm of Caring played a foundational role in my family's journey. And it's one of the main reasons I moved to Colorado Springs in search of compassionate, informed care for my kiddo. My kiddo's name is Mads. They go by they, them pronouns. So you'll be hearing that throughout this. I also want to say what's interesting is that cannabis, which I've been taught growing up to fear as a so called gateway drug, actually became a gateway in a very different sense for me. It opened the door to learning more deeply about natural substances, neuroscience, trauma, patient advocacy, and the importance of evidence informed care. And after witnessing firsthand how much relief and stability that cannabinoid therapies could provide for some families, including my own, it completely changed how I understood these conversations. And that experience, eventually led me into a broader work I'm doing right now.
That's fantastic. Every organization loves people who come, bring their work, bring their experience to then build the work that they're doing. And that sounds exactly what has happened for you. And it's, never a road that you want to map out, but boy, it's a road that you feel solid in because you've lived it and effective, right? Super effective because you understand what works, you know the landscape, and then that's what we do. We're helpers and caregivers to help the next person just do it more efficiently without less strain for that gain, right? That happens. And so that's just a fantastic role that you're in right now, Dara. I'm so glad to hear that. How about you, Piper? Tell us a little bit what you're currently working on to amplify the medical patient voice.
Our family is doing a road trip documentary. We're going from Houston to Canada, stopping in DC for an advocacy day. And along the way, we'll be stopping to talk with different patients to share their point of views. And then we'll also have some professionals, providers on there as well, including David. But in our journey with cannabis, I found that it was really difficult to reproduce the results. And, with the patchwork of access throughout the country, and so many people who think that medical cannabis needs have been resolved. There's this disconnect between what patients are experiencing and what the public thinks has been accomplished. And we are, in fact, seeing some backlash from legislators with the McConnell ban. And so we're taking it to the street to get those
Absolutely.
perspectives from patients to be able to change the minds and the policy and all of that.
Great. Well, if for anyone listening, you were muted for a little bit, but Piper is working on a documentary called Pop Bound, and we can talk a little bit more of that in the questions, just because I think it got cut off before you came on to hear you. So I just wanted to clarify that. So thank you for that work. It'll be really exciting to see the results or hear the story, so to speak. All right, well, let's start with, as we know, and as we're going to hear, mothers and caregivers are often, they are the deciders, right? They're the strongest advocates within the healthcare journey for their kids, navigating these complex medical systems. And until you have something of your own, or then have to manage that for your loved ones, you don't realize how complex that is, alongside ensuring that your loved ones' voices is heard, and then the care that you have to give. You come to a moment where you're saying, boy, my family's experiences have made me realize that are forced to become our own medical experts. And then, like we're hearing from our guests today, forced to go into areas like Dara was saying, into neuroscience, and then just payment systems and drugs that you've never heard of, or advocacy that you never thought that you would be part of. And so sometimes it's a blessing in disguise, right, as some would say, because it usually is. Your experience always adds to it. So Dara, can you start share deeper, right, that journey that led you to first explore cannabis, right? Because it's not always the tool that's offered, right? You probably either sought this out or you can share with us. And then tell us a little bit more about your move, because you are one of the family refugees of cannabis, with Colorado coming online medically first, and then having a great community here that developed from that. You're part of that original group. Tell everyone about that. It's a fantastic journey that's
It's a fantastic journey, but I also have a huge privilege to be able to do so. So I just want to word that. I first began exploring cannabis as part of my kiddo Mads, who is now an adult at age 21, during an incredibly difficult chapter of our lives. Mads was diagnosed with intractable epilepsy, along with other complex mental and physical health challenges. And at the time, I was navigating repeated seizures, ER visit, medication side effects, extremely limited treatment options. And after multiple medications failed to provide stability, I was also facing a very heartbreaking prognosis about what the future might look like. And I'll try not to cry because it's still, despite it being so long ago, or seemingly so long ago, it is still at the heart of everything that we do on a daily basis. A major turning point came in July of 2013 after a 4-day epilepsy monitoring unit stay at Johns Hopkins Hospital, where a hemispectomy surgery was being discussed. And around that same time, I saw videos of the dear late Charlotte Figi, and it completely shifted something in me. By the way, Charlotte's Web was named after Charlotte Figi, in case you're not aware. And for the first time when I saw that video, I saw another possible path forward for families like us dealing with severe epilepsy. That led me and my kiddo to move to Colorado Springs because Realm of Caring was headquartered here, and they were offering families a real journey, a pathway, I should say, of understanding cannabinoid therapies, connecting with doctors, finding community support during a super overwhelming time. So I also like to try to acknowledge, like I said before, my privilege here in being able to make that move because many families could not afford to relocate to care. I met parents that left their jobs, their homes, their support systems behind just to pursue options for their children. That experience ultimately shaped the advocacy and education work I still do today. It taught me how important compassionate care, caregiver voices, and access to evidence informed information really is.
Thank you for that. And absolutely acknowledging right now that it is a privileged, either you're privileged with the financial resources to obtain just the product itself because it is not covered by insurance, or the privilege to be in a state that has acknowledged it as medicine so that you have a route. But remember, this is a cash pay, so it's cash pay to see clinicians when you're seeking the route of this plant-based therapy. It's not covered by any insurance. Workplaces, if you're, managing that in a workplace, doesn't schools, right? In the context that we're speaking about, if you need to continue care for your kid, the schools will not administer. And so you would have to come in and administer medications to your child. Well, if you're at work, again, that's another privilege that maybe you have one caregiver that can go do that in your resources. And not everybody has both either financial or the people resources or the system resources. Every step is pushing through, right? Every step, I'm sure that you were pushing through. So I'm glad that you acknowledge that um, it's a privileged resource, and it shouldn't be. It's a right to choose this as medicine and should be covered under our healthcare benefits. But we're not there yet, right? But we are definitely moving towards that. And with the movement at the federal level, we're really hoping that will enhance the experience here with those seeking these tools to help their child. So how about for yourself, Piper? Let's hear from you. Share what your journey that led you to explore cannabis. Was this in your world before, and then, the part about obtaining treatment. Tell us more about that.
So, same as Darla, a lot of overlap, and a lot of overlap with a lot of other cannabis patients and parents. My son had intractable epilepsy. Diagnosis was Lennox-Gastaut syndrome. And as a hygienist, I was cleaning teeth and always getting up to answer the phone from the school nurse for seizure calls. And patients would always say, "Have you seen the Weeds documentary with Sanjay Gupta and about Charlotte Figi?" And so that was something that started to cross my mind. We have a lot of family support with my mom and my family in the neighborhood, my husband's family close by. So it didn't feel like something that was possible for us. We kind of entertained the idea of moving to Colorado, but with the family support, we decided to go ahead and stay in Texas. And so I got some weed, found a recipe online, and this was after my son's doctor advised us that he was likely to soon lose his ability to speak. So that kind of pushed us past considering to actually doing it. Found the Absalon Essentials Guide on the internet to make THCA tincture, and the first tincture that we tried for our son was fantastic. The whole time he was on it, he didn't have any seizures. He came back to life where he was sleeping 20 to 22 hours a day. Became a normal kid again for that 6 weeks. And then after the 6 weeks, we tried another tincture that didn't work as well. And so I knew that I knew pretty quickly that there's this nuance to treating with cannabis. And so I kind of took that on as my torch to carry that people need to understand that, and especially with legislators and policymakers, that it's critical to understand that we don't understand a lot with cannabis, and we're kind of digging for that needle in the haystack every time we medicate. And it is possible to achieve fantastic results, but it takes a lot of trial and error, even after you find success sometimes. So so yeah, that's part of my journey. There's a lot more than can be talked about on a short
Yeah,
podcast.
well, let's talk about. I do want to highlight your point about trialing, or first one, making your own, taking it into your hands, and making sure that you were in control of the product because you didn't have access to tested or products like we did in Colorado. But the other point was the trial, and you say trial and error. I like to say trial and track, but you're always tracking, right? Throughout any cannabis treatment or plant-based treatments. Really all medications, our body changes, situations change, but going back to products and why it's so important that we need these standards in products that are being put out there, and safety in regards to being tested, and to make sure that they're free from things that would make us sick, like we would want from our foods and all of our other supplements as well. Anything we consume, we would hope that the layers of our regulations are there to protect the foods that we consume. So really getting into where you said, wow, I found something that worked, and how sometimes that's hard, even in a regulated state, to find consistency in products, but especially hard for those that are making it their own, or in an unregulated state, that you have to get creative in finding the formula, right? The just right formula you found. It's really important to know exactly what you were consuming, what was the ratio of the molecules, right? And what other parts of that product could be going towards the success of the management of symptoms, right? That you're all looking for. So
Well,
that go ahead, Tabor.
well, something I wanted to add on there, test and track, and this is reality still for a lot of people in a lot of states, and with the potential pushback on cannabis. that we're seeing is that you mentioned track. I couldn't track. I felt like it was too dangerous for me to have some written evidence that I was giving my son cannabis. And so, I mean, the threat of law enforcement was really there, and it is still there for a lot of people.
I'm so glad you brought that up, and to the level of fear that now our parents are having to provide something that you saw that worked, to not even put it down on pencil and paper in your own little diary, right? Their own that fear is so big, and that this is the barriers that anyone who's accessing medical care for cannabis. But for a mother, I mean, you're talking about protective services could come in, and or even just stigma within your family that happens, that really inhibits or delays the good care that you're finding, right? And we're up against that over and over. So that little point is really showing how much fear there still is in the legal. And if we could open that up, we could open up a lot of things that we need to know. Like you're saying, we don't know a whole lot, but we about it because it hasn't been researched to the level that we know that it's needed. But we do know a whole lot about things that we have seen by trial and tracking with positive outcomes, good outcomes. So thank you for sharing that. Um, so going along with that, Piper, you had, I look forward, you had brought up the pot-bound documentary that you're working on, focusing on these unmet needs of the medical patient. And you collected stories across the restricted South, which is a view of itself, right? Because Dara and I here in Colorado, we have access to a lot of stuff. And I'm glad you brought up medical is not like done like they we don't have all the things that we need to make this as easy as any other medical choice, and so there's still work to be done that we're all doing here. But in a restrictive state, and hearing the stories through the South of collecting these stories that you learn, about how they're obtaining it, what they're doing to get the care that they need. But you had brought out up the point about how the Farm Bill affected so much and the risk that's coming with the Farm Bill this fall. Would you like to talk about these real world consequences would look like if, and we're talking about all CBD hemp without any trace of THC in our hemp products, which is where we find a lot of fantastic formulations for a lot of medical conditions, especially epilepsy. Piper, we'll start with you. What are these real work? Tell the audience how does the rubber meet the road if the Farm Bill goes through and you don't have access yet again?
Well, I mean, I don't know. I think like the thing is, I think a lot of attorneys would even say they don't know what the landscape is. Uh, most people in policy in law don't expect anything to happen really, I guess, before to keep the ban from going into effect. But I mean, I guess the hope there is that the rescheduling happens, and that kind of interferes with the ban somehow. But we don't know still what's going to happen with with that. Even the timeline, I guess, is coming up pretty quickly here. But I mean, it's just horrendous to be able to think about so many people who are using CBD products that they're able to get through the mail. And when we had access to CBD through the mail, that was really kind of game changing for us because our son seemed to kind of rely on strains that were related to ChemDog, and so um, you know, just accessing illicit cannabis here in Texas, ChemDog was hard to come by. And so I was able to order through a CBD provider and was able to get that, for a little while until they stopped stocking the sour chem that we were getting from them. But I mean, these kinds of things are issues that I feel like are going to continue to need to be addressed beyond medical legalization, because you know patients do have such nuanced needs with what they require from cannabis, and we don't have a lot of knowledge about it yet. And it's going to take some time to get that knowledge to say, well, these are the specific molecules that will help with this condition. So I don't know. I feel like home grow would be the only way to assure that people would have access to what they need. But yeah, I don't know. I guess I haven't given that a lot of thought because I feel like I hope that it doesn't happen. I mean, how can you take away something that's been giving life to? I mean, I can't get past this. I'm sorry.
Yeah. Yeah. I
That's
mean,
giving
you're
life
talking
to
about,
so many people, and we haven't even got to the finish line yet. And here we're pushing people back from the finish line. It's not fair and it's not right.
yeah. I hear the where the rubber meets the road, meaning that with the Farm Bill, it opened up the ability for hemp to sell products just because of the wording to, across state lines because it was in an agricultural product and an acidic form, which means you can't get intoxicated off the product. These are logistics that really muddied the water and our progress in the industry since 2018's Farm Bill kind of started to really get rolling. It opened up access for a lot of people, which was wonderful, although that access was not regulated. So therefore, you had to rely on your own navigation to determine if that was a safe product to consume, especially inhale, right? Often, kids aren't inhaling, but that there is a role at times for it. But on the other hand, it opened up this whole network of other molecules that really flooded our conversation away from medical, away from what's still needed. So what Piper's talking about is ChemDog has a certain formula. So when we say cannabis, we have to define what we're talking about. And when we talk about these molecules, they're in different ratios in each of the plants, just like tomatoes, just like wine, where there is a Pinot Noir to a Cab. Why? Because there's different expressions in the genetics, and then there's also different inputs from the way that you grow. And that is important for the caregivers as leaf nurses. We're looking for that too to help patients match to their right, but it's always a trial and track. But when you find something, it's hard because sometimes it's not available again. And that's where standards can help and open up federal cross state lines so that we really can find a small farmer that's going to grow the just right strain that we have found and match. That's the beautiful connection that can happen, is that we match patients with farmers to grow what they need. And whether it's in homegrown or boutique or even in, mad pharmaceutical science, I think we're going to get there, especially if we can open up research. So thank you for that. And that's real world feeling. How about Dara? What do you think about real world consequences in regards to the shift in the Farm Bill? What did it do for your care? With, you know, tell us more about that, about how it impacted you, what was opening and access, and then what would happen if well, you're in a regulated state, but tell us more about finding the right product for your care.
Yeah, so I'll try not to be too redundant, but one of the biggest risks that I see that policymakers can do is easily disrupt the stability for patients who already have protocols that are working. So, medical cannabis care is often highly individualized, as you heard Piper talking about, and also for every single parent that I know out here, which is a huge group currently. Um, especially for people with complex neurological and mental health conditions. And for my kiddo, this meant constant dose changes, trying available options, including making my own as well, full spectrum cannabis oil. My kiddo saw the best results from THC. So that limited our ability to travel. Which may come up later in our conversation. And when strains or brands would stop producing the beneficial medicine that was working, then you have to start it all over again to try to find what works again and risk it. This happened year after year, sometimes months after months, and constantly trying to find strains and brands that work because they don't sell that anymore because they're really just given for the recreational, like what works for the recreational, and they don't really need it for medical. It just creates chaos, really. And a lot of this would happen when mad seizures were increased because all of a sudden we're running out of medication quicker. And now I have to scramble to try to find something to like cope with what's happening currently, as well as trying to find what works. And by the way, making that full spectrum cannabis oil takes a full day. I had to use independent labs to test it because the labs here in Colorado, despite the decriminalization, the labs here are only for actual medical dispensaries. It's not for, so I had to find like an independent lab and pay out of pocket for that as well to test it because my kiddo is so like the smallest amounts, work best. And then, everything had to be measured. I also worry that the recreational market sometimes overshadow the medical patients and that adult access matters, but medical patients often need different protections, like you're saying, Mo, with product consistency, affordability, caregiver access, long-term stability. And when the systems shift too heavily towards commercial priorities, then medically vulnerable people end up deprioritized. So in my kiddo's case, consistency and access to those trusted products and knowledgeable providers were and are the most incredibly important part. It takes years sometimes to find something that creates that stability. And by the way, Mo, you mentioned earlier, so don't even get me started on the policies around cannabis in school districts, because despite it being life-saving medication for my kiddo and used in oil form. So we're not talking about my kiddo smoking. Like, I just want to verify that. And I'm not going to downplay those who need to smoke medically, but my kiddo wasn't smoking and needing to smoke to stop seizures. It was given as an oral form, in oil form. And it could not be legally administered even on school property. So I heard you mention like you would have to go to the school to administer it. Well, I had day programs tell me I couldn't even come to the school, that I'd have to pull my kiddo while they're seizing off the property to administer it. This is in day programs, this is in the school district. And even though that it is, there are systems in place to make it legal, that's still not allowed here. So there are many children who are still experiencing this. My kiddo is now out of the school district. Those policies created major barriers to education, accessibility, and that's just keeps going on and on. So if they become inaccessible, then the real world consequences obviously can be severe. We could lose seizure control. We can experience worsening systems. We may have to return to medications with difficult side effects or end up back in the emergency rooms more often. Some families are even forced to relocate or seek products through unsafe pathways. And I think policymakers sometimes underestimate how fragile medical stability can be for families already carrying enormous emotional, physical, and financial burdens.
Absolutely. Thanks for sharing that. Yeah, I mean, each state has different rules on it, but for pediatrics, and there's not a lot of protections for families choosing this. And then there's a lot of scrutiny and assumptions, right? That we're getting the child high. or that they're smoking, like you're saying, and that's majority of not the ratios. So when we say again cannabis, you have to quantify what are you talking about? What ratios? High CBD, low THC. What is the formulation? Because everyone direct or not everyone, of course but unfortunately the public or regulators are quickly thinking about the excess of high dosing, which could be utilized very effectively for the chances of a small part of risk that's always there anyway to the gain of everyone who is using these products effectively, safely, and without harm. And so I always like to kind of reiterate that to make sure that when we say cannabis, it is not just high THC products being smoked. These are oils enriched with beautiful molecule formulations that have been trial and tracked to just right medicine for them. So these real world consequences, if it's funny because we have two things happening at once, so that's why it's so kind of mixed of what is going to happen, but we do know if we lose access to both the hemp side, which gave us high CBD, like Dara was saying, the adult side, the commercial side of the cannabis industry have been kind of not um, noticing the value of bringing in high CBD, low THC products because that really is the medical product that most use. So hopefully we can see them utilizing and bringing these products into that space to have them available. But again, that's not always available to pediatrics, and that's again the challenge. So hopefully we can bring this into a full system. So let's go ahead, keep going with you, Dara. Kind of what does it say about our healthcare system, right? When families must become their researchers, like you're saying, you're going into all kinds of topics that you never thought or should be there. A researcher, a pharmacist, you're an advocate, you learn about labs, all while taking care of complex medical conditions. Um, when like through the system, where did you kind of get that pushback of dismissiveness or uninformed that you were able to inform the healthcare system of what works for families?
Thank you. Yeah, what this says is that there's still major gaps in our healthcare system. We, as caregivers of medically complex children, were forced, like Mo said, to become researchers, coordinators, advocates, watchdogs, on top of our responsibility to just be a caregiver in general, which takes up 24/7 hours of our time at times. My family became what Mo mentioned earlier, a medical refugee when we moved to Colorado Springs. And that's because the restrictions that are here with THC is state for the state. Those policies are for the state. So therefore, we couldn't leave the state with THC because no other state around Colorado, especially for in the beginning, recognized it the way Colorado did. So we weren't able to travel. So I had to wait until Mads was 21, which just happened in the fall of last year, to leave the state legally. Now I still couldn't travel with the THC, but at least I could travel to a state where, because they're 21, they would be able to access cannabis in that state. This took a lot of work. So this was a lot of planning. This was over a year worth of planning to make sure I could do this legally and safely. I worked with Dr. Getty, who's a medical cannabis physician and cannabis related expert witness, to formulate a treatment plan for the trip. And at the same time, Medicaid was refusing and it's been over a year now that I've been requesting this, to cover a portable oxygen concentrator for travel. This is despite the medical need of oxygen during seizure activity. I can't travel with the tanks. You're not allowed to travel on airplanes. But they deem this medically unnecessary because traveling is not a need. So now my mother facing stage 4 cancer in Oregon, I may have to pay thousands of dollars out of pocket to just safely travel with a portable oxygen concentrator. We did get to go to Disneyland. I want to say it was an interesting trip. I had to pay for a portable oxygen concentrator out of pocket, and it was huge. It wasn't like the portable that you see people carrying on them, which are the ones that cost thousands of dollars. The one they ended up giving me was on wheels. So if you could just imagine, my kiddo has a service dog, portable oxygen concentrator on wheels, luggage. As a single mom traveling, who can imagine doing this? Um, I've had to also advocate repeatedly inside the healthcare systems. I'll just give you a couple of scenarios here. I have a long list. I could write a book about them.
I hope
Uh,
you do.
I had to report a nurse for giving an unknown amount of ketamine that was administered without informed consent. I later this year had to report an ER physician who made assumptions about Mad's seizures based solely on outward appearance, despite 16 years of EEG documentation. Thankfully, my kiddo can communicate well because a couple years ago at a day program, I had to advocate for them withholding food from about 35 students because one kiddo had behavioral issues. And thankfully, my kiddo spoke up to me about it and I was able to report them for that. But this is constant, okay? So, like I said, I could write a book because this is happening all the time with medical patients with special needs, children and adults in day programs and all sorts of areas where they don't have the ability to communicate quite as well. And we need some patient protections and caregiver advocacy to be more essential in these areas. And what these experiences have taught me is that advocacy is not optional for many families. It becomes part of survival.
That is very true. And unfortunately, we lost Piper. So I'm trying to figure out how to get her back in. So what I'll help you continue to share. So as we can hear, navigating through not just the healthcare system, because that's what we were speaking about, but all the systems that you have that you navigate, right? And as soon as you come into public health systems of schools or programming like camps and that type of thing, we're forgetting that, right? We're thinking of just medical and how you have to show up, but it's about your daily, your everydays, even in regular uh, life systems that you are coming across. Continue with this. What policy changes do you think? I'm glad that you shared the state to state because that's probably uh, a big thing for us, right? Of not realizing that when you choose this medication, it's not like you can pick it up at a pharmacy in another state, and as we know that it could be and would be of value. Traveling through states gives irregularity in products too, because with the way that products are made, some states have to have it made in that state. So then that also makes it super hard. So you have to work with someone to know what formulations are in those other states, and then therefore most likely other products. So what policy change do you think is going to be the to improve the patient stability, and access? Tell us more about where you think could really help medical patients.
Well, yes,
And I see
protecting.
Piper back, so go ahead and then we'll turn to Piper and I'll reiterate. Thanks,
Yeah, glad
Piper.
glad to have you back, Piper. Um, yeah, I think obviously one of the important policy changes would be protecting that stable and affordable access. I also think health providers need far better education around cannabis informed care. Families should not have to become the primary researchers, like we mentioned before, the navigators of their own while caring for someone with a complex condition. Another major need is continuity of care. Sudden regulation changes, loss of trusted products, barriers for caregivers can deeply disrupt patients who have spent years finding protocols that work. And like I mentioned before, that can also include the school and day program policies. In many cases, even physician directed cannabinoid medications in the oil form can't be administered, right? Like I mentioned, and that can disable students' access to education and safe participation in programs. So I think there's a major need there as well. And then I would say finally that policymakers need to include patients and caregivers in the conversation. They shouldn't just be making this based off of what they think they know. Often we are the ones who truly know, right, Piper? We're the ones who live it. We know we need to be included in that
100%.
conversation.
Absolutely. 100%. It's fascinating. I mean, because you're busy doing the work. And then that's getting more work is to get in front of these legislators and educating them. Piper, share a little bit more. What policies changes, either it be in your state or nationally, could help the stability and safety of Zach's medications and care?
Well, there's a lot of ground to cover in Texas. But I think, and I mean, I guess on the national level too, because there's nothing nationally that's really happening except for the acceptance of the state medical programs. I think, like I said before, home grow, I think is something that I think is vital for patients until we get to the point of being able to understand what is needed and to make sure that there's a supply there for patients. Because I mean, who knows what cannabis is so complex and so nuanced that I can't rely on. So Texas just expanded 11 additional licensees in addition to the first three. So I mean, when we're talking about chemotypes or chemovars or strains or whatever you want to call it, um, they have limited income, they have limited cultivation area. What are the odds that they're one of these 14 in Texas is going to be growing what my son needs? And then also, what other patients may need, which is likely to be different from my son. So I think like a focus there that this is a nuanced medication that is going to take a lot of work to understand. And then here I feel like one of the big things with research is that we need some sort of way to be able to track and kind of hone in on those different chemicals that may be playing a vital role. I mean, we talk about cannabinoids, we talk about terpenes, and now we're talking about flavonoids in this conversation. But who knows what else there could be in the cannabis that's contributing to the therapeutic effect, and we want to make sure that we're not skipping out on that. So I think there needs to be some sort of tracking with the research so that we can hone in on the therapeutics, and at least until we get to the point of understanding what is therapeutic in cannabis, home grow, so that patients can access what they need.
Absolutely. Thanks for that. I'm an advocate for home grow. I teach beginner home grow, more of a connection to the plant, but which is part of the care, right? But home grow rights are not innate to any medical program or any adult program coming online. So you do have to advocate for that, because everyone should have the right to be able to grow a plant no matter what. And then you have the access that you need at all times, like all food, right? We should be able to grow any of our own foods and our own herbs and medicine as a basic civic right. But it does identify that we have so much variances in care. But I do know, like through universities, there's apps. One that will, it is Tetragram where patients use. There's other out there. There's universities are really starting to, and organizations like Realm of Caring and others out there that are collecting either these patient stories or patient outcomes. There's studies that are active. So looking at Realm of Caring, they have some active we're looking for participants all the time. So look at universities that are doing some of the work, because keep an eye on them, because you might be a candidate to take part in there. But what's holding us back from the federal being at Schedule 1 and now move medically, fortunately, to Schedule 3, I think we are going to see more collaboration, more of consolidation to aggregate this data, because I do know it's there. Leaf 411, our cannabis nurse guidance line, has been in operation taking calls and collecting this data. And we're excited to look at that to see if we can glean any information from what we have heard just directly from people obtaining products, you trial and tracking them, and then what are those outcomes. So I do think there's lots of pockets that we can learn from once we are not held back from not being able to talk about it, share information. And even like you said, you really hit me with that fear of even writing it down in a diary. That hit because, you know, we're asking patients to come on to medical programs that are attached to a state government as well. And that feels scary as a parent. And you know, touching on that feels really scary, really, for an adult. There's lots of adults that don't want to utilize the medical programs that have been set up out of still fear that there will be some kind of repercussion to them at their work, or if there is any infraction with the law, that they'll add it to it. We're not safe. We don't feel safe yet, and hopefully we can get to a safe place that we can exchange these ideas. And Schedule 3 is really helping us get there, right? Um, uh, what are other kind of resources that along your line, we can go back to you, Dara, that we haven't talked about that you want to share? And I was looking in to see if we have any questions. Go ahead. You can put them in the chat. That would be great. Let me pop over. Dara, would you like to share with any other resources? You provided us with a lot of resources to share with our audiences. This is really why we're here, is to share your stories, but also share resources. What do you think was, how did you care for yourself? What helped you keep going, and what helps you keep going now, to keep this message and moving along?
That's the key thing, is keep going. Keep swimming. Is what you have to do. There's not a lot of choice in that matter many times either. Thankfully, I have the energy to keep going. Some of the great resources Dave put right in the chat there. You can find my LinkedIn. If you have any more questions, feel free to contact me. Unlimited Sciences, which is that psychedelic research, because that gateway drug introduced me to more natural substances that opened up what else can help people. That there's a lot of lack when it comes to depression, PTSD, veterans, and mental health. And so there is that gap that exists right now. And there are natural substances that are leading, the way. And there's more to be told there. Unlimited Sciences also has an AI bot that you can speak to that can give you answers privately, as well as you can book an appointment with one of our navigators to explore questions more one-on-one if you need about natural substances. Realm of Caring was mentioned as well. Realm of Caring has been around since since I first moved out here, and to say that we were a pilot family, one of the first 25 to move out here, because at the time 400 moved out here. At that time of, Piper mentioned the Sanjay Gupta weed documentary, 400 of the privileged families that were able to move out here moved out here during that time. And we were one of the first 25 to move out here quickly. And I'm very thankful for that and where that's brought us to. Medicinal mindfulness is actually the school I go to. I'm becoming a psychedelic facilitator myself. I did not mention that during this, but I'll just throw that out there since that's one of the links there. And feel free to go to Medicinal Mindfulness for more information. To here in Colorado, it's in Boulder, Colorado, to receive those psychedelic therapies there, or go to school to become a facilitator yourself legally. Getty Whole Health is Dr. Getty, who I mentioned prior, who has helped us since we first moved out here, and is a legal cannabis doctor in Colorado and in Virginia. And then the rest are not mine, so I'll let you go on, but hopefully that's helpful.
Absolutely, absolutely. Thanks for all those resources. Piper, what helped you along the way? And then I do have a question from the audience that I want to share. Go ahead. What helped you along the way? What communities, what resources?
So
Oh, we lost you, Piper. Go ahead and unmute. There
sorry,
you go. We can.
I'm doing it from my phone. It's,
Awesome.
we had
You're
a power
awesome.
outage. So,
Yep.
so,
We're here. We're mothers. We'll figure it out.
so yeah, you just keep swimming, right?
Yes.
So I found there was a Facebook page, CBD for children with epilepsy was significantly resourceful. I don't feel it's as great of a resource now, but it was a big resource for me, and it was a great way for me to connect with other moms, and that's how I know a lot of the moms that we'll be talking with through the documentary. Um,
Wonderful.
but yeah, I mean, I don't have a lot of resources because I come from the knowledge of, well, I went to the U Maryland School of Pharmacy MCST program, the Medical Cannabis Science and Therapeutics program
Yes.
also. And I feel what I learned from that was that we need to know a lot more. And so I kind of, I know that there's resources like that Dara already had spoken
Yep.
about. Realm of Caring is a great one. And Americans for Safe Access and S3
Yeah.
Collective, ASTM International, all of these
Those are
are
wonderful.
fantastic resources. But yeah, I think I mean, like I've been talking about, a lot of it is trial and error, trial and track kind of thing. And I'm doing the movie popboundmovie.com is where you can find the documentary information. And if you're interested in being in the documentary, we would love to talk to you.
Wonderful. Yeah.
Love to share the stories. We've had, I mean, I think one of the focuses is also on advocacy. I've been an advocate since 2014 in Texas, and then at the national level as well. Um, and for to help people to understand how difficult it is when you're facing all of these challenges, emotional, financial, physical, to go on and advocate also. And I feel like we have had so many advances. Zach is verbal, he's got mild cognitive delays. He doesn't have any physical constraints or anything like that. So I know I've been blessed by cannabis. And I know a lot of people who, who they were able to get some great results, but unfortunately have lost their kids or are still facing tremendous difficulties with their kids, and they can't advocate. So I think that just keep swimming is a great mantra for me too, because I really feel driven to tell this story for all of those wonderful moms that I know
Absolutely.
that
Absolutely.
don't have the ability to advocate for their kids for some
Absolutely.
reason or another.
Absolutely.
So
Thank
it's
you for your work.
popboundmovie.com.
Oh, okay. I heard movie.com, popdownmovie.com. We'll check it out. I do have one quick question to get in because somebody asked, and I'll put it out there, but they're asking about what products can be manufactured that's helpful for medical patients. And I want to say, first and foremost, keep it clean, know all your resources and making sure that there's clean processing and clean products, organic, generative, outdoor sun cycle plants are always our best. that's gold standard. But getting it tested, any products tested. But I think what you're looking for too is that, we hear about tinctures besides tinctures, and tinctures can come in two ways, an alcohol base or an oil base, and they're usually taken sublingually. There's also other routes, suppositories, topical patches, even like strips that you put in the buckle of your mouth. There's even like nasal sprays that are, in the work. So there's a lot of products out there that manufacturers are giving a try. And that's how, when you work with someone, you can match the route of the consumption and the product when you work with a clinician to trial and track, but always kind of keeping it clean. But the challenge in manufacturing that medical patients are finding is that the adult use commercial side is leaning towards high THC products with no other minor cannabinoids or other things that Piper spoke about in the plant that is helping with the conditions. And then in the hemp side, we have a need to then have to vet so hard, because you need to make sure that the products are grown and made clean, and that's not regulated by any states at this time, other than your awareness of who grows your product, who makes your product. So manufacturers have a huge role, and we hope that you're making clean, safe products for us, no matter what side of the plant you're on in regulations. All products need to be clean. All food needs to be clean. All herbs and any consumptive, all candles, lotions, all of that stuff. We need manufacturers to be making clean products, because especially when you're using it medically, we're reduced immune systems, sensitive systems. Anything that either of you want to say before we go to manufacturers to make products that better fit? Go ahead, Dara.
Okay. Yeah.
It's such a
You
good
know,
question.
so I'm mentioning right now it's okay to mention some brands. Is that what I'm hearing? Because this was a question.
Well, we want to know just the processing, right? Because we know that
Mm,
brands are vetted, but in the manufacturing process,
mm.
you know, besides tinctures, what other products are helpful for medical patients? And I'm
Yeah,
just
I'll
saying
I'll
that.
go through some products that we've used over time. Nasal spray,
Mhm.
THC. We've used the oral that I mentioned before, in the oil form. We've used patches, like was mentioned before, and the patches are work a little bit quicker. The oral sometimes would take an hour to an hour and a half. Just to really work and work well. So sometimes that was waiting a long period of time with a ton of seizures before it actually is working. Vaporization of the flower. So I'm not talking vapes have a bad stigma because of what happened with all the oil
With yeah,
vaporization.
you've
Yeah,
only
but you can actually vaporize flower products. This could be a
safely.
CBD flower,
Hmm.
and your what vaporization means when it comes to flower is that it is toasting it rather than burning it. So that's my layman's term for basically instead of smoking all of those carcinogens, you're vaporizing it and you're getting actually more of those terpenes we discussed earlier. Also thinking about the synergistic effect of things. So yes, flavonoids have a purpose, the terpenes have a purpose, the cannabinoids have a purpose, and all these big words, right? But really, it's everything together that creates a big purpose for the individualized care. So all of this matters in product, the testing, and so hopefully that gives a little bit more.
Absolutely. Thanks for sharing that. And as you can see, there's many ways to consume cannabis. There's many types of cannabis, and it does matter the route of consumption and the formulation and constant trial and tracking to get to a outcome that you're needing and to stay with that. And that's why national standards, national rescheduling, increase access for medical patients, acceptance into all of our health systems and all of our life systems would open this up for mothers and caregivers to, rightfully and legally and safely and consciously give this product its rightful place in our healthcare system. So we are at the top of the hour and went a little bit longer. So we appreciate these stories from mothers. They are very important, and we hope you found this of value. So thanks again. We are back next month on the 24th, and we are going to talk about the one plant solution of the debacle of these different regulations that we're looking at this year and how that's going to change the way that we access our medical care for cannabis. So thank you, everyone. I appreciate you all being here. Take care now. Oh, I gotta stop.